Thank you, Deputy Speaker. I rise to speak on the Health Insurance Amendment Safety Bill 2015. And this bill is the result of the Abbott-Turnbull government's infamous 2014-15 budget. Who could forget it? Who could forget that budget? I remember the booklets being handed around in Moreton before the election, the Real Solutions booklet with the photo of the federal of the coalition's front bench, Malcolm Turnbull sitting in there smiling. That budget completely repudiated what was in the Real Solutions booklet and the promises made by the leader of the coalition. Surely the most blatant case of false advertising that anyone has seen. To paraphrase Lionel Hutz, Lionel Hutz would have more chance of arguing the false advertising case against the Abbott-Turnbull government than his suit against the movie The Never-Ending Story. I mean, it was unbelievable. All the promises contained in the Real Solutions booklet completely thrown out by the 2014 budget, and this piece of legislation is a direct result of it. It is put forward by the government as a potential saving of $270 million. Of course, if there is a saving to the government, it must also mean that there will be a cost to someone else. That's the reality of economics. We know with this government that the cost is always going to be borne, sadly, by those in Australia who are the most vulnerable, and this legislation before the chamber is no different. Medicare is one of the great legacies of the late Gough Whitlam, and I particularly acknowledge him today on the 40th anniversary of his dismissal by the Queen's representative, Kerr. Medicare, introduced by the Whitlam Labor government in 1975, originally called Medibank, renamed in Medicare in 1985 by the Hawke Labor government when it was reintroduced. In the 9 months after Medibank, after it was implemented on the 1st of July 1975, the staff increased from 22 up to 3,500 and 81 offices were opened. Medicare today is accepted and loved by all, particularly on this side of the chamber, as we accept it as Australia's universal healthcare scheme. It ensures that all Australians can access our world-class healthcare system. The savings from this bill arise from changes that the Abbott-Turnbull government have brought into the Medicare safety net. The Medicare safety net can be a confusing system to navigate, so I'll just give a brief description by way of background. And I sort of wanted to bookend this brief description by taking people back to a Four Corners interview on the 6th of September 2004 with the then Health Minister, a bloke called Tony Abbott. And the interviewer, Ticky Fullerton, asks, will this government commit to keeping the Medicare Plus safety net as it is now in place after the election? Tony Abbott, yes. Ticky Fullerton, that's a cast-iron commitment. Tony Abbott, cast-iron commitment, absolutely. Ticky Fullerton, 80% of out-of-pocket expenses rebatable over $300, over $700. Tony Abbott, underline this and put it in bold. That is an absolutely rock-solid, ironclad commitment. That was the Minister for Health, as he then was in the lead-up to the 2004 election, when the member for Adelaide was elected, on a tough day for Labor, where we talked about where Medicare was a big issue in that election campaign, but we saw the Health Minister make that commitment, that rock-solid, ironclad commitment, and then by March, I think it was, March the next year, he did a backflip. So he had form. We should have realised when it came to the 2013 election, the commitment that was made before the election was not going to be something that he would hold true to. And we saw that with that 2014 budget. Now, there are currently two safety nets in operation, the original safety net, which applies to all Medicare card holders, and the extended safety net, which has two limbs, one applying to concession card holders and the families eligible for Family Tax Benefit Part A, which has a lower threshold to the second limb, which applies generally to all Medicare card holders. The two safety nets operate quite differently. Under the original safety net, once the threshold of $440.80 has been met, the patient would receive 100% of the scheduled fee for out-of-hospital services. Under the extended safety net, once the threshold of either $638.40 for the concessional threshold or $2,000 for all other Medicare card holders is met, then 80% of out-of-pocket costs will be covered. At present, all out-of-pocket costs for our out-of-hospital Medicare services contribute to the safety net threshold. I repeat, at the moment, all out-of-pocket expenses, pocket costs contribute. So under this bill, this cruel bill, the out-of-pocket costs that contribute to the threshold will be capped at 150% of the MBS schedule fee. So on first inspection, this bill appears to be the patient's friend, but the devil is in the detail, because it does decrease the safety net threshold, and ordinarily that would create savings for the patient. But because this bill also places restrictions on the out-of-pocket costs that contribute to the patient reaching the safety net, this makes the task of reaching the threshold more difficult for the patient. These changes will have huge impacts on thousands of patients in Moreton, from Chelmer to Currabee, from Fairfield to Oxley, from Annerley to Willawong, and every suburb in between. Sadly, the amount patients receive back from Medicare after they reach the safety net will also be reduced. The Australian Medical Association, not exactly a left-wing organisation, are very well placed to comment on the effects of this bill and how it will impact on their patients. And they've criticised these cruel Turnbull changes. Professor Owler, the president of the AMA, has said, and I quote, "The new Medicare safety net arrangements, together with the ongoing freeze of Medicare patient rebates, mean that growing out-of-pocket costs will become a reality for all Australian families, including the most vulnerable patients in our community." End quote. Professor Frank Jones, the president of the Royal Australian College of General Practitioners, another organisation that has direct connections with the implications for this bill, said, "Coupled with the indexation freeze, the legislation will actually increase the cost of care to vulnerable groups. Safety net thresholds will increase by CPI annually, while rebates remain frozen." Both of these organisations, the College of GPs and the AMA, have noted how this will impact particularly on the most vulnerable. It's revisiting the tactics of the 2014 budget. This bill will particularly impact upon radiation oncology patients, cancer patients who are undergoing radiation treatment. Surely people at a most difficult time in their lives. Those patients have more than enough to deal with but then being exposed to more out-of-pocket expenses. By way of example, a patient with a malignant melanoma, which is sadly a reality in Queensland, who is receiving stereotactic radiation treatment could face further out-of-pocket expenses of $7,400. A patient with prostate cancer undergoing volumetric modulated arc therapy treatment could face further out-of-pocket expenses of $8,000. A patient with breast cancer undergoing radiation therapy through a private provider could face a 200% increase in out-of-pocket expenses. These are not incidental amounts that these patients will be faced with. Patients will be slugged with extra costs at the very worst possible time in their lives, normally also while they are unable to attend work. So the last thing these patients need is further stress, wondering how they're going to pay for the treatment that they hope will keep them alive. Another sector of the community who will be impacted by this bill are patients undergoing IVF. Australia has been at the forefront of IVF research since the 1970s, brought joy to many, many households across Australia. The first IVF birth in Australia was in June 1980. It was only the third IVF birth to occur anywhere in the world. There are now, I think it was in Adelaide actually, from memory. Oh, I have to check.
I was just a baby myself.
It was you.
It wasn't.
There are now more than 10,000 babies born through assisted reproductive technologies each year in Australia. It is estimated that patients who currently pay only $4,000 per IVF cycle, still an expensive decision, now will be slugged with a bill of between $10,000 and $15,000, also at a difficult and stressful time in their lives. That is a huge increase in cost, particularly when couples often go through more than one cycle of IVF, and that increase could be crippling to a young couple trying to start their family. Imagine their stress if the IVF cycle is not successful. Not only will they be terribly disappointed by their failure to conceive, but also the knowledge that in order to have another chance to conceive, they will have to face these huge costs again, another expensive roll of the dice. The President of the Fertility Society, Associate Professor Mark Bowman, claims that this bill will result in 1,000 fewer babies being born every year and an increase in sets of twins, triplets and other multiple births. The Royal Australian New Zealand College of Psychiatrists also has concerns about this bill. One of their concerns is that people with serious mental illnesses will no longer have access to psychiatric services. They're also concerned that sexual abuse victims, who are currently the subject of the Royal Commission into Institutional Child Abuse, will also not have access to psychiatric services. Psychiatrists and psychotherapists have warned that these changes will lead to an increase in the incidence of suicide among this vulnerable patient group. So there is much at stake for this group of patients and the groups that I've mentioned. And it's not just the extra costs of service. The existing arrangements provide that all out-of-pocket costs for our out-of-hospital Medicare services count towards meeting that threshold. This bill will restrict the out-of-pocket costs that will contribute to reaching the threshold, making it harder to get to it in the first place. And once the threshold is reached, there will be further caps on what will be covered. This is a cruel policy. The purpose of the safety net, the very essence of what the safety net is about, is to ensure that when a person faces a large amount of out-of-pocket health costs in any one year, that they will be protected. This purpose underlines the basic principle of Medicare, that every Australian should have access to the highest quality of medical care, regardless of their capacity to pay. That's what Whitlam was about when he introduced the bill in the first place. I know Fraser overturned it, but then the Hawke government brought it back in, and it's been accepted by John Howard, by every Labor Prime Minister, obviously, but even by Tony Abbott. But now they're undermining that universal healthcare principle. It's the most vulnerable patients are the ones that will suffer because of this legislation. Those with cancer, couples undergoing IVF, people with serious mental health illnesses, or victims of sexual abuse. They're the ones who are going to be hit by the financial impact of this bill. This government was elected on the promise of no cuts to health. That was the commitment given by the leader of the coalition before the last election. That promise did not go past their first budget, and now we're seeing it made even more worse. There was a GP tax, $57 billion in cuts to hospitals, and now this $270 million in reforms to the Medicare safety net. This bill is nothing short of a cut to public health. In real terms, it will mean massively increased out-of-pocket costs for some people, as I said, particularly those who are most vulnerable. I know from my constituents that people value the Medicare system and they care about protecting it. Just yesterday, one of my constituents posted on my Facebook page this comment, and I quote, "As an older woman, I say leave us alone. My husband is fighting cancer. We both paid our taxes, Medicare levies, and for 54 years my husband struggled to pay for private health. Why? Because he believed, like many in our age bracket, that we were protecting our family's welfare. You have no idea of struggle." This bill will hit the most vulnerable in our society the hardest, and for that I condemn the Abbott-Turnbull government. People battling with cancer treatment deserve more. People struggling to start a family with the assistance of IVF need to be considered, particularly with the benefits that will come for our society as birth numbers decrease. People who are victims of sexual abuse and people suffering from mental illness do not need this. Could this bill be any more cruel? I ask the Health Minister to reconsider this piece of legislation, and I ask the Turnbull government to reconsider this bill, and I will not be supporting it.